It's a great first lecture, kind of setting me up. I've got a little bit of overlap here, but tons of slides, a lot to go over, so I'll kind of get started right away. So what I want to focus on is the acute back pain. I think everyone in the room has had some degree of back pain. They wake up in the morning, it hurts. They're out weed whacking and it hurts. And then I want to talk about the pain that is continued, that pain that comes and goes. Severe pain, a little bit better, but not all the way gone. And last, some simple tests that we can do for your back. The next thing is, what do we call it? When somebody comes in, they were out doing something, you go to the urgent care, you're going to be given these diagnoses here, backache, lumbago, maybe some spinal degeneration. But I think the better name to cover those is probably more the mechanical back pain. And that has to do with a little bit of what we had on that first lecture. It talks about the posture, difficulty with flexibility, some weakness, and that control of those structures. The spine is extremely complicated. You've got joints, discs, you've got nerves that run in between these little holes. You've got a spinal cord that comes down, then a bunch of nerves that come down together. You've got ligaments and muscles. When I look at them, it's more generalized. It's up and down their back. It's in their muscles on the side. It aches a lot. They can't move any direction because it's a little bit sore. What could it be? My back is still hurting. There's a lot of different things that can cause back pain. You've got the discs, herniation, degeneration, the little joints in the back, the bones themselves with fractures and infections. And then there's other things as well, like the tumors, again, that we're trying to rule out. Sometimes the rheumatologic conditions can present with back or neck pain, so we want to keep those in the back of our mind. And other weird things. Sometimes aneurysms can be felt in the back. Kidney infections can be felt back here. Sometimes prostatitis. A term that I just wanted to bring up here, that disc herniation. Here's some kind of basics. There's a degeneration, which is the wear and tear, the breakdown. And then you got the kind of protrusion, which kind of pushes out in one area. And then it kind of pushes out and spits out a little bit. And then it pushes out, spits out, and kind of blows a piece off. So there's different degrees of those. Other things, again, common stuff that people tend to ask, and they come in and see a doctor, they're worried about a fracture. Sometimes those fractures can cause slippage. Again, it's kind of this part of the backbone that holds it there, and this can slip forward. So really quick, I just want to touch on a couple tests that could be done. An EMG is a nerve conduction study, electromyography. It's a way of kind of evaluating your nerves. Not only are they being pinched, but also are they being damaged. So we can see if there's weakness, we can look into different nerves and see if there's a problem with those. The x-rays, it's a good starting point. When you see a doctor, he just may order an x-ray. Let's kind of get an idea of your arthritis you got back there. How much breakdown do we have? Do we have any big compression fractures? They kind of give us a starting point of kind of what's going on in your back. MRIs, I'm not going to spend a lot of time. Those are the most helpful. They show kind of the very, very good detail. Another test that sometimes is done is a CT. Again, that's kind of the older test, used to be done. It looks good at the bone. If we're looking for a fracture or something, that can be really helpful. Those are just a lot of times that breakdown, wear and tear sort of things. Most people will have those on their back. It doesn't mean that that's causing your pain. And actually that's more confusing sometimes, is having all those changes, trying to figure out which one is causing my pain and which one is just part of my gray hair. So that's where it gets tricky.